Hi guys, welcome back to my channel. My name is Onyinyechi. I'm a family nurse practitioner, and our channel here helps nursing students to break down these topics that bother them in school. So make sure you go ahead and subscribe to my channel. Make sure that you share and you like the video so I can keep putting out these PowerPoints to help you explain these topics a little bit easier. Today we are delving into hyperthyroidism. Now, as we talked about before, the thyroid gland produces T3, T4, and calcitonin. And remember when we said T3 and T4 help to regulate the metabolism, but calcitonin helps to regulate or reduce calcium levels in the body when necessary. Hyperthyroidism, hyper means high, thyroidism refers to the thyroid, so hyperthyroidism happens when there are high levels of the thyroid hormones T3 and T4. Now, as we said, T3 and T4 help to regulate metabolism, so if there are high levels of T3 and T4, this is going to lead to increased metabolism more than the usual body's regulation of metabolism. Now, what are the causes? The big one you see in your textbooks is called Graves' disease, and it is an autoimmune disorder that causes overactive thyroid. So the immune system in the body goes and attacks the thyroid gland, causing it to become overactive and release a lot of that T3, T4 hormone. Other causes are thyroid nodules, thyroiditis. As you know, Itis means inflammation. So thyroiditis, inflammation of the thyroid, and then some other medications can also cause hyperthyroidism. Now, I always tell you to match the signs and symptoms of a disease process to the pathophysiology of what is going on. So we've talked about how hyperthyroidism refers to a fast metabolism, faster than we want the metabolism to be. So what might you see a typical patient who has a metabolism that is fast? What signs and symptoms do you expect? Anxiety, tremors, tachycardia, and irritability, right? Everything is go, go, go. So the body is moving very fast. And so it also causes diarrhea. Diarrhea, you're losing lots of fluid, you're metabolizing nutrients and everything too quickly, it would lead to weight loss. And then it can also lead to menstrual cycle disturbances as well. These patients also have an increased intolerance to heat. They're always feeling really hot, even when the room is cool. And so that causes them to sweat excessively as well. A big one to remember is something called exophthalmos, and you will see it as a protrusion of the eyeballs. So that Graves' disease that I told you can cause hyperthyroidism, it also attacks the tissues around the eyes, and that causes some swelling. So that swelling pushes the eyeballs forward and causes them to bulge. And so we call that exophthalmos, and you will see that in your textbooks, so make sure that you remember that for nursing school. The diagnosis is made by high T3 and T4, but a low TSH level. And if you think about it, the body sees that there is a high level of T3 and T4 floating around in the system. And so the thyroid stimulating hormone is like, okay, we don't need to stimulate for any more production of T3, T4. It seems like it's already a high level in there. So when you make diagnosis, you might see a high T3 and T4, but a low TSH level. Now, as the nurse, make sure that you're matching your nursing responsibilities to the signs and symptoms these patients are having. So we said the patient may have a heat insensitivity, right? They're always feeling hot. The metabolism is doing too much. So your job as the nurse is to provide them with a cool environment. And make sure that it's comfortable and quiet because their body is already doing a lot. They need some peace and quiet. A high-calorie diet because the metabolism is moving and they're losing weight. So you want to make sure that the diet is a high-calorie that's going to support all that nutrient gains to help them to maintain their weight. You might give medications called methimazole, PTU, beta blockers, and iodine. And a lot of them work to help in supporting or reducing that high level of thyroid that's causing the metabolism to be go, go, go. Like beta blockers help to reduce the heart rate. And in case the patient also has increased blood pressure. So make sure that you're monitoring blood pressure levels, just vital signs levels in general, because you need to be able to notice big differences so you can know when to call the doctor. Another thing that might be given sometimes is iodine, and iodine works by inhibiting the release of thyroid hormones, right? Because we say they already have high levels, they don't need anymore. Big one to remember for your exams: if you're giving iodine, you want to give it with a straw because it stains the teeth. And then the treatment for hypothyroidism may include the use of radiation to shrink down that thyroid gland, or a thyroidectomy where the thyroid gland is actually removed. So thyroid and ectomy means removal, so removal of the thyroid gland may be done to help to stop that overactive nature of this condition. Big thing I want you to keep in mind: there is something called a thyroid storm, and this is a life-threatening condition that can happen with untreated or uncontrolled hypothyroidism. So signs and symptoms we may see include hyperreflexes, so the patient's reflexes are doing the most; tachycardia, a fast heart; hypertension, high blood pressure, and all the other symptoms that we talked about for hyperthyroidism. So I hope this helps you to break down this topic. I want you to always think in the line of pathophysiology to deem what might be going on and what your responsibilities are as the nurse or the nursing student. I hope that this helps you. Don't forget to subscribe to this channel, share this with somebody who might want to be educated about it, and also like this video. Until the next one, thank you for staying to the end of the PowerPoint. I hope you have a wonderful day. Bye-bye.